Hello everyone, myself Rubeenabenakanahalli from College of Agriculture, Vijaypur, University of Agriculture Sciences, Dharwad. Today I am presenting the topic COLIC, given by course teacher Dr. S.Y. Mukherjee, Associate Professor of Science, College of Agriculture, Vijaypur. Colic mostly occurs in horses. Colic denotes abdominal pain or pain within the digestive tract due to gastrointestinal disturbance. Colic is number one cause for death in horses, excluding the old age. Colic is a multifractional disorder that appears to be induced by environmental factors and possibly genetic predisposition. Its epidemiology: it occurs throughout the worldwide. Incident rate ranges between 3.5 and 10.6 cases per 100 hours per year. In Bikaner horses, overall prevalence of equine colic was observed as 12.8%. According to types of colic, the prevalence was found 29.4% in impactive colic and 70.59% in spasmodic colic. Let's come to classification of colic. On the basis of causes of colic, first one is a spasmodic colic, impactive colic, obstructive colic and sand colic. On the basis of duration of disease, three types: acute, chronic and recurrent. The duration is less than 24 hours, chronic 24 hours to 36 hours, recurrent colic was more than 2 days in normal. Next, according to causes of colic, spasmodic colic. It is the most common type of colic. This type of colic may be caused by changes to the diet, inadequate deworming, teeth problems, and excessive intake of cold water following exercise. Signs usually discontinue after few hours. The signs during the colic may include increased gut sound and slightly elevated pulse, that is 60 beats per minute. The normal pulse rate in horses is 28 to 42 beats per minute. It is also considered as medical colic. About 80% of colics are spasmodic. In a spasmodic colic, a section of the gut goes into a spasm, preventing anything from moving it past it. Spasms mean contractions occur in the gut region of the horse. Next one is the impactive colic. Most common cause of this colic is impactions of large intestine. Most impaction colic cases at the pelvic flexure. Poor dental care, irregular feeding, or where the horse suddenly starts to eat its bedding are important factors. Vascular shock may be evident due to dehydration and absorption of toxic material from the stomach. Next one is obstructive colic. Term refers to an uncommon sudden occlusion of the intestinal lumen by organized impaction. This may be due to enterolysis, phytolysis, hardened fecal mass, foreign body and clump of parasites. It is divided into two groups: vascular or functional obstruction, mechanical obstruction. Enterolysis means stones occur in intestine. Next one is the sand colic. This is most likely to occur in horses that graze sandy or heavily grazed pastures. Ingested or dirt accumulates in the pelvic flexure, right dorsal column and the cecum of the large intestine, irritates the lining of the bowel and leads to diarrhea. Sand that makes irritation and impaction of intestine. Risk factors for sand colic are soil type, pasture quality and feeding practices. Next, let's come to symptoms of colic. Loss of appetite, increased pulse rate, that is 60 beats per minute or more than that, excess salivation, abdominal pain, flank watching means seeing at their sides, biting the stomach, decreased fecal output, depression, lip curling and dog sitting posture, pawing, stretching and rolling. This is kicking at belly. This looking or biting at sides. This one is excessive rolling. This is stretching out. Next, treatment of the colic. Correction of pain, hydration therapy by two types, replacement therapy, maintenance therapy, and other therapies are there: antibiotics, lubricants, and fecal softeners. Prevention of this colic is Maintain a regular feeding schedule. Ensure constant access to clean water. Do not feed moldy hay or grain. Feed hay and water before grain. Maintain a consistent exercise regime and etc. Colic also occurs in human beings, that is, newly born babies, infants. It leads to excessive crying. Thank you.